A cardiac CTA exam must be ordered by your physician. Most insurance companies will cover your cardiac CTA. However, you may need pre-authorization from your insurance company. To assist us in scheduling your exam, please have the following information available when you call: your contact information, such as address and phone number, indication for the exam, referring physician name, and insurance information. To have your cardiac CTA, you may be asked to visit Diagnostic Imaging Associates twice, once for your consult and the other for your actual exam.
It's a non-invasive procedure. It's an outpatient procedure, provided you meet the certain criteria for the cardiac CTA. It may save you a trip to the hospital for cardiac catheterization and the costs associated with that and the minor risk associated with that. So it's an alternative that did not exist several years ago.
On the day of your consult, please arrive at the medical office building located to the left or north of the hospital's main Garfield entrance. Parking is available to you at Garfield and Ohio just north of the building. Once inside the medical office building, you will go to Diagnostic Imaging Associates, where you will be greeted by an admission representative.
How may I help you?
I'm here for a CT scan.
Then taken to the nursing area to have your blood pressure taken and answer some questions about your medical history.
Do you have a history of heart disease?
No.
Your medical history will determine whether or not you should undergo the cardiac CTA exam. The image quality of cardiac CT examinations is highly dependent upon your heart rate during the scan. The desired heart rate is approximately 60 BPM. An oral beta blocker may be prescribed for you if you have a high heart rate the evening prior to and the morning of the exam. On the day of the exam, you will be asked to not consume any caffeinated beverages or foods such as coffee, tea, caffeinated sodas, or chocolate. Do not eat or drink at least 4 hours prior to the exam. However, you may take any medication that you usually take with a small amount of water. You will need to arrive 60 minutes prior to your appointment time. This will allow the necessary prep to occur prior to your heart being imaged. On the day of your exam, you will arrive and park at the same location as the day of your consult. You will again be greeted by an admission representative. You will change into a gown and proceed to the nursing area where the nurse will check your blood pressure again. You may be given a beta blocker again, the medication used to slow down the heart rate. An IV will be inserted in your arm for the intravenous contrast injection. If you have a known contrast allergy or had a reaction to contrast dye, please tell your physician and the nurse or CT technologist prior to the exam.
We're going to have you sit down here and then lay down with your head on this pillow.
Once inside the CT room, electrocardiogram leads will be placed on your chest in order to monitor your heartbeat. Before beginning the cardiac CT exam, you will be coached in a method to hold your breath.
Bring both arms above your head.
During the exam, you will be asked to hold your breath a few times for 12 to 18 seconds.
We're going to go over some breathing instructions with you just so you know how to hold your breath during the test.
The CT exam itself lasts only 10 to 15 minutes. You will have no restrictions after the exam and can return to normal activities. Typically, the results of any examination will be available to your doctor within 24 hours. Your doctor will communicate the results of your study directly to you.
This is an example of a computer tomography generated model of the heart in a three-dimensional analysis. The red denotes the heart muscle. As you can see, there are the vessels that overlie the heart muscle are actually the coronary arteries, the blood vessels that supply the heart muscle. The largest vessel right here in the middle of the field of view is the left anterior descending coronary artery. If you look carefully, you'll see a very short segment of constriction or narrowing that differs from the rest of the coronary artery. This is the right coronary artery, and this is a diagonal branch. With the use of the post-processing, we can further quantitate the severity of that narrowing or blockage. This is a curved rotational analysis of that same left anterior descending coronary artery that we saw in the three-dimensional view of the heart. And what it identifies is a short segment reduction in lumen diameter that's produced by a soft plaque. And you can see the degree of lumen stenosis and irregularity here. What's also significant in this case is there's a significant amount of heart muscle downstream from that lesion that's at risk for infarction or dead muscle if this were to completely occlude.
Once the CT exam is complete, you will be monitored for a short duration in the nursing area. According to the American Heart Association and American Stroke Association's 2006 publication on heart disease and stroke statistics, cardiovascular disease remains the leading cause of mortality in the United States in men and women of every major ethnic group. It accounts for nearly 1.4 million deaths per year as of 2002 and was responsible for 1 in almost 3 deaths in the United States in 2003. Approximately 13 million individuals have a history of coronary artery disease, and almost 2,500 Americans die of coronary artery disease each day, an average of 1 death every 35 seconds. Cardiovascular disease claims more lives each year than the next 4 leading causes of death combined: cancer, chronic lower respiratory diseases, accidents, and diabetes. Please contact your physician today to see if a cardiac CT exam is right for you, or call Diagnostic Imaging Associates at 686-5277 for more information.